and Facebook in. We're going to ask. So the tagline for today is, if you think OCD is just fill in the blank. If you think OCD is just hand washing, if you think OCD is just light flipping, if you think OCD is just having some person, if you think OCD is just thoughts about morality, if you think OCD is something that's just a little neatness, a little organization, we all have a little OCD, that it's a misnomer, it's a myth. And OCD can be quite debilitating, right? So OCD can be a reason why people get health issues. OCD can be a reason why people have skin problems, major skin problems, which can lead to more difficult things along the way. It can be a reason why a person struggles with parenting. It can be a reason why a person would struggle with a relationship or marriage. So why is this? Why would something as thought be something that could cause so many problems? Why could this be such a burden? And how difficult is it to explain to a family member, a friend, that this is what's going on? Well, it's because if you've never had OCD or never experienced a portion of this, it might be really difficult for you. So let's back up for a moment. So the first thing is, what is an obsession versus a compulsion? Because OCD is obsessive compulsive disorder. An obsession is the thinking. The compulsion is the actual behavior that you see outwardly. Now, technically, behavior is any person can. Behavior could be your heart beating or your mind thinking, right? But an obsession is usually the thought that just keeps going over and over and over in the brain. And so then the compulsion is the response to get the thought to go away. I'm dirty, I'm contaminated. If I don't go wash my hands right now, I'm going to be very sick. So I wash my hands, and then I wash my hands again, and then wash my hands again, because the thought keeps going over my brain in this little area called prepassive circuit, where it's going between my thinking, my feeling, and my doing part in your brain. Okay, amygdala, hippocampus, hypothalamus. That goes on and on and on and on and on again. And that is why the person will do the obsession and the compulsion again and again and again and again and again. It's that intrusive thought. That's an intrusive thought. Sometimes people say, I'm having these intrusive thoughts, like with bipolar, I'm having these intrusive thoughts with other things. Maybe, but more than likely not so much. A true intrusive thought is something that you feel like you are compelled to actually do a behavior to undo the thought. That's a true intrusive thought. And it usually is coined, connected, related to the OCD. We use the term intrusive thought very, very loosely, very loosey-goosey. But often they're taboo thoughts. It can be hyper-religious, like, I want to have sex with a child. The person really doesn't want to. They're not really a pedophile, okay? There's a difference between a pedophile and a person that has OCD, that has these pedophilic thoughts. They really don't want to be with the child, as opposed to a person who's a pedophile that really wants to be with the child. They're having these thoughts. They really don't want that, but they keep having this thought to do this. That is you could also be a checking reassurance. I didn't move on. And I check, and then I leave the room, and then I go back again. I have to check again and again and again. And the problem is that it robs you of time. It robs you of relationship, because that constant going back and checking, now 2 minutes turn into 5 minutes turn into 30 minutes turns into 50 minutes. And this person has not been able to leave their house. They're late for their job. They're late to leave the house with their spouse. They're late for this appointment. They're late for that appointment. Eventually, they might even lose a job, or they're losing sleep, and they're losing peace of mind, because they know that it might take them 2-3 hours to go through this ritual of checking and reassuring themselves. And so, in other words, instead of waking up at 6 o'clock to get to work by 7 or 8, they're waking up at 2 or 3 o'clock in the morning, so they have time to go through the ritual, so that then they're not late for whatever the event is. And then if you disrupt that, that can be very difficult. Yes, you can see OCD in other things. You can see it in autism. You can see it in schizophrenia. You can see it in other conditions. You could theoretically see it in other forms of anxiety disorder. That's why I'm very big about determining what type of anxiety disorder this is. Is it social anxiety disorder? Is this generalized anxiety disorder? Is this OCD or some other kind of impulse control disorder that kind of coincides with an anxiety disorder or masquerades or looks like an anxiety disorder? Very important. That's why you have to do a thorough history. Right. And it's not just about perfectionism alone. So sometimes people will say, oh, I'm just a neat freak and I just have to have things in a certain way. So I'm constantly doing these things this certain particular way. It's the combination of the thought with the behavior. Again, that's what makes it OCD. The obsession, the thought, plus the compulsion, the behavior. If you don't have the thought plus the behavior in this loop, not OCD. Not OCD, something else. You just have the thought and then you just say, I'm afraid of going out socially, otherwise I'm gonna get into trouble. I'll just stay home. The only behavior is you just stay home. That's social anxiety disorder, more than likely. That's not OCD. It's the thought plus the behavior again and again, 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 again. Loop. Okay, there has to be a loop. Again, Papez's circuit, PAPEC. Now, I want you to think about this because this is what can become a real problem for a person with OCD, where they can become reclusive. And again, where other people, either family and friends, don't fully understand. They may be having these thoughts like, what if I am going to hurt somebody? What if I backed up and I really think I ran into somebody and I have to keep checking again and again and again, and other people just don't understand? Clearly, you didn't run over somebody. You hit a bump in the road. Yeah, but what if? Okay, it's the what ifs that really take them out. What if I'm secretly dangerous? I'm having these thoughts about hurting women. I'm having these thoughts about hurting children. I don't really want to do that, but I'm having the thoughts. This is a closet illness for many, many people. They often won't come to medical attention until they're brought, okay, or they're in such debilitating ill health, they don't really have a choice. So when it's really, really bad, sometimes we don't even know about it in the mental health community. Didn't tell you who I was. I'm Dr. Regina. I'm a double board certified psychiatrist as well as a lifestyle medicine advocate and physician. So as a psychiatrist, I can tell you I've seen people with OCD who really struggle. Usually it's derm. Usually dermatologists are referring people to me because they think they've got a contamination on the skin, and the dermatologist's done testing, they've done skin testing, and they're like, there's nothing there. There's nothing there. But they really think there's an infestation. They really think there's contamination. So they're washing, severely damaging the skin and causing problems. Sometimes we'll see it in parenting because there's a form of OCD that happens postpartum. And there are a lot of postpartum illnesses, but OCD postpartum. So there's postpartum depression, postpartum anxiety. The hormonal changes can sometimes spark something that lie dormant. So an example would be like an OCD where that parent didn't have these intrusive thoughts about hurting their child before. Now they have them. And that manifests after praise can be very debilitating because then that parent doesn't want to do anything with the child because I'm afraid I'm going to drop them. I'm afraid I'm going to hurt them. I'm having nightmares. I'm having bad dreams. Yes, it can happen even while the person's asleep that they're having these bad thoughts, right? Because what you're thinking about during the day, when you're works, heart still pumps, lungs still make oxygen exchange, your kidneys still flush out toxins, and you still, that's why you have to go to the bathroom at night. So these folks will still sometimes have this torment even in their sleep. You know, not just what if I hurt my child, what if I contaminate my child? If there's a contamination concern, these OCD things or these OCD symptoms can be quite debilitating. Yes, I see it within the religious or sacred or Christian community. Yes, I've treated Christians with forms of OCD before. And it can be everything from I'm not a good enough Christian, so I have to keep doing these prayers. It could be to do these manifestations because if I don't, then something really bad is going to happen. So it's either prevention of something bad, or I have to do it because if I don't do this particular behavior, it's going to invite something bad or it's going to cause something bad. I have to be very wary because I could hurt my child, right, or contaminate my child. The key phrase, which when I do my 3 to 5 minute talk a little later, and actually share, not the live, but the sharing that I do later. The key, people don't want these thoughts. People don't want these thoughts. It's not fun. It's not sexy. It's not, ooh, I'm going to organize my life, Ayanla, or, I'm going to have tidying up my home. and I'm just a slightly little neat freak. No, these people don't want these thoughts. It's incredibly distressing, right? The compulsions are what they do to reduce the anxiety, the checking, the washing, the reassuring themselves, the mental rituals, the need for prayer. It's exhausting, but it's treatable, of course. Yes, antidepressants can be an option. Yes, therapy can be an option. Unfortunately, lots of times people will try to do the therapy without a medicine, and that'd be difficult because it's too overwhelming to sit and think through a therapy. That's why medications can be very helpful. Antidepressants are what we try first, of course, and there are some specific ones for anxiety disorder that we can use. What's another thing? TMS. TMS, transcranial magnetic stimulation, very much can help with functioning. And sometimes people will say, we use something called the Y box, the Yale Brown obsessive compulsive syndrome. We'll look at that, and that is the test to see how high your score is before the treatment, and then we'll redo it after the treatment. And then we can see, hey, there's been significant improvement. Sometimes the score is not the gold standard. A reduced score is important, and I appreciate that. But for me, function trumps everything. Function trumps everything. In OCD, function trumps everything. Depression, I want to see those scores go into remission. Okay. Other anxiety forms, I really want to see those scores go down drastically. OCD is probably the only one where I will do a diagnostic test. And even if the scores don't drastically come down, I'm okay with that. I am okay with that. Why? Because the person can tell me the score only dropped 3 points, but their ability to function, huge, huge. Their ability to function has greatly increased. That's much more important to me. When they tell me that I can go and drop my child off at school, have to immediately go home and take a shower because of contamination issue, I can actually go and run in, right? Ability to function doesn't matter to me that they only went down 3 points. If you tell me that you're able to do the work, you went from I'm having to get up at 2 and 3 o'clock in the morning and I don't need caffeine, I don't need Monster, I don't need all these other energy drinks, I don't need 3 cups of coffee to go throughout the day because I didn't have to get up until 5. I didn't have to get up until 7, and I was able to make it to work by 9 or 10 because I didn't have to. What matters to me. I don't care if I went down 3 points or 10 points. You don't have to get to remission for me as long as you feel that your ability to function has improved. That is what matters with OCD. Okay, that's what matters with OCD. So I hope this has been very helpful for you. If you know someone that has OCD or seems like they have OCD, and yes, there's a difference between OCD and OCPD, which is obsessive compulsive personality disorder. That's the, oh, I'm a little neat freak, I got these little tendencies. That is not nearly as debilitating as OCD, right? We've had people be hospitalized for OCD because they're not able to function as a spouse, they're not able to function as a coworker, they're not able to function as a parent, they're not even able to live within their own skin. Okay, can be incredibly debilitating. That's OCD, not OCPD, right? Most of your high achievers, lawyers, doctors, we got a little OCPD. Yeah, I want this just the right way. My notes need to be just the right way. I need to study in this exact pattern because I made the A in this exact pattern, so I got to keep it up. Your basketball players that are like, I need to wear my lucky socks that can't be washed. They haven't been washed in 20 years. I mean, that's another problem, but that might be OCPD. Or you just have some ritual that you feel like you have to do to win. Little OCPD there. Not OCD, because you're still able to function despite all these things. Okay, so there's a difference. Just keep in mind those things because, again, very important. And I want you to know this. So put in the comment if you, again, if you think it's OCD, it's just, if you think OCD is just my light switching, flipping. If you think OCD is just me being a little neat, put those things in a comment, but then put the real in that, no, it's not just this. And loved one, and you want to see if TMS is helpful for you. Of course, we do it here at Led Life. We do it in our company. We have 3 different devices, and we have a device that's specifically made for OCD. We do use the BrainsWay, but that doesn't mean everybody is near our office. TMS is worldwide. It's worldwide, and there are even mobile TMSs. There's a device that can be put in a van or medical van or facility, mobile facility, and brought to a person to do TMS. There are some forms for maintenance, not for guys. But for instance, there are devices that can go home. Most devices has to be done in a facility with a trained provider. Once they've seen treatment, usually need about 20 treatments with provocation. Let me tell you that. There needs to be provocation. We need to, unfortunately, make you feel a little distressed. We don't want to send you 10 out of 10, but you should be slightly anxious, 4 to 7. Uncomfortable, I'm sorry. But the device and the treatment through the TMS will calm the mind, will calm the brain, and you'll go back down underneath that 4 out of 10. So by end of treatment, we're aiming for 2, 3, somewhere around there, that your anxiety has limited if we've got you up to like 4 to 6. I really don't like to push people to 7, but 4 to 6. So we talk to you about the thing, try to provoke you, make you think about something that you don't like, see something you don't like, do something you don't like, in a very calm way. And then we proceed with treatment, and you will notice a difference in the first 20 weeks. If people don't notice a difference, even with provocation after 20 sessions, we offer them more, but I'll be honest with you, after 20, usually I'm telling people, hey, let's consider doing something different. Let's consider another type of a treatment, because there are other treatments. Oh my gosh, there's so many other treatments. Usually they're more procedural. Yes, there are some surgical options, but for people with debilitating illness, it's a godsend. It really is. Okay, I am Dr. Regina, and TikTok, I'm going to end you first because I started with you. You guys have a very blessed day on purpose. And for my folks over here on Instagram, YouTube, what else we have over here? LinkedIn, Facebook. Again, you guys have a